Merci.
I will now call the meeting to order. Welcome to meeting number 22 of the Standing Committee on Veterans Affairs. I would like to welcome two new members to the committee, Mr. Terry Dowdell and Mr. Blake Richards. I would like to also say welcome to Mr. Michael Cooper, who is replacing Katie Rockenthal. I would like to also remind members of the committee that Mr. Nam Shukru will be our clerk this afternoon, and Madame Audrey Delaire is also here to assist the proceedings of the committee.
1082 and the motion adopted on Monday, October 3rd, 2022, the committee is meeting on its study of allegations that medical assistance in dying was offered to a veteran unprompted by a Veterans Affairs Canada employee. La réunion d'aujourd'hui.
Today's meeting is taking place in a hybrid format in accordance with the House Order adopted on Thursday, 23rd of June 2022, and members will be present either in person or via the Zoom application. The proceedings will be published on the House of Commons website. For your information, I'd like to also add that the webcast will always show the person speaking rather than the whole committee.
Participating virtually, I would like to outline a few rules to follow. You may speak in the official language of your choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen or either floor English or French. If interpretation is lost, please inform me immediately and we will ensure interpretation is properly restored before resuming the proceedings. Pour tous les participants.
A reminder to all participants, please make sure that you speak slowly and clearly, and if you are not speaking, your microphone should be muted. I would like to now welcome our witnesses. First of all, we have Honorable Lawrence Macaulay, Minister of Veterans Affairs, who is accompanied by Mr. Paul Lidwell, Deputy Minister, and Stephen Harris, who will be joining us by video conference, who is the Assistant Deputy Minister for Service Delivery Branch. I will now give the floor to Mr. Macaulay, but before that, I just want to underline one point. 2 weeks ago, we took place in an announcement concerning Juno Beach. I just wanted to update the committee on this. We issued recommendations and the report on Juno Beach. And Mr. Desilets, a member of our committee, Vice Chair, was also present at this conference. So before giving the floor to Honourable Minister, I would like to give the floor to Mr. Desilets. Mr. Chair, can we just confirm that the sound tests have been successfully completed for those joining remotely? Yes, that has been done. Okay, Mr. Macaulay, Honorable Lawrence Macaulay.
Less for your opening statement. Please go ahead.
Thank you very much, Mr. Chair, and thank you for your invite to come before the committee. And I also would like to welcome the new members of the committee and look forward to working. And we're looking forward to the work that you will do on behalf of Canada's veterans and their families over the coming weeks. I hope to be able to address the members' concern about an unfortunate situation that came up over the summer when a Veterans Affairs employee brought up medical-assisted dying with a veteran. The first thing that needs to be said, Mr. Chair, is that this was completely unacceptable. Our government places the highest priority on ensuring that veterans and their families have the support and services they need when and where they need them. This includes ensuring that encounters with Veterans Affairs Canada are conducted in a respectful and compassionate way. Once I learned of the incident, Mr. Chair, I ordered immediately and thorough internal investigation into the matter and asked my department to ensure that something like this would not happen again. Thankfully, to our knowledge, we found that this issue is to be isolated to one employee and is not indicative of a pattern or behavior or a systemic issue. It is absolutely not our department's place to provide advice about medical assistance in dying, and it never has been. Our frontline staff had no mandate or role to recommend medically assisted in dying to our veteran clients. We have made that clear to all frontline staff, and that any conversations on the matter are for the patient to have with their primary health care professional. Since the incident, our employees have received updated guidance about how to handle situations where a client brings up this in conversation. We have communicated specifically about medical assistance in dying with all of our frontline managers and employees to ensure that something like this does not happen again. Again, Mr. Chair, this is a very regrettable incident and was completely unacceptable. But the issue was isolated to one person. On the whole, Veterans Affairs employees always strive to provide the best, compassionate service to Canada's veterans. I thank you, Mr. Chair.
Thank you, Minister, for your opening remarks. And right now, for the first round of questions, for 6 minutes, I'd like to invite Ms. MP Blake Richards to open his mouth, to start. Okay, please.
Thank you, and thank you for your remarks, Minister. You know, as the new shadow minister on this file on Veterans Affairs, I just want to say what I've said to you privately, publicly as well, that I don't think that when we talk about our veterans, it should be a partisan issue. And you have commitment from me that that's not how I will approach this file. But I will do something that is critically important, and that's that I'll always demand from yourself, from your government, and from your department that they show the utmost respect for our veterans, that they're always shown that respect for the service that they've given to our country. And I think the subject we're talking about today is an example where that failed to happen. And you've acknowledged that, and I appreciate that. But, what we're talking about is a situation where a veteran came to Veterans Affairs looking for help, in a very, very serious, situation that this veteran was dealing with, and he was crying out for help. And what he got instead was a suggestion that he consider accepting assistance to kill himself. And it wasn't just made one time. It was suggested to him numerous times, and there was some insistence on the part of the official that suggested this to him. That's the understanding that I have of the situation. And that is completely and utterly unacceptable, and it does not show the respect for our veterans that they deserve. Now, I do appreciate that you've acknowledged that you regret the incident happened, and I appreciate that you have made steps to try to move forward to make sure it doesn't happen again. You did say in your opening remarks, and you have said publicly, that you have been assured that administrative action has been taken, and you are confident that you want to ensure this will never happen again. Can you tell us, Minister, exactly what actions have been taken? Have all those actions been completed? And are you absolutely confident that this will never happen again?
First of all, I thank you very much for your words, because you're absolutely right. Partisan issues in other areas, but when it comes to veterans and what they've done for our country and for democracy and peace, and we look at what's taking place in the world, I thank you so much, because working together we can make it better for sure. And I can assure you, when immediately upon hearing this, I instructed my deputy to conduct an investigation on this, just what happened and really what took place. And he's sitting right here with me, so I think it'd be more than wise to ask him to explain that to you.
Yeah, and if you can just do so kind of, as briefly as you can. We don't have a lot of time, obviously, but I would like to hear what's been taken. But I would like to hear from you before we do that, Minister. Can you assure us, and can you assure veterans, that something like this will never happen again?
I will assure you, my friend, I'll do everything to make sure we're dealing with human beings, trying to help human beings. There's no excuse for what happened here. It's totally wrong and unacceptable. I'll do everything in my power to make sure, and I'm sure the deputy will emphasize that, but to make sure that the likes of this, it is awful, unacceptable, just no other place, just terrible, and we have to make sure that this does not happen. But we have a great group of public servants in Veterans Affairs. This was wrong in every way, but I'm going to give my deputy a minute. Go ahead.
Go to your deputy, because we do have him for some more time as well later. Can you tell me what the consequences were for the individual involved, for the VAC worker involved in making this repeated suggestion to a veteran that was completely and utterly offside? What were the consequences in that situation for that employee?
Well, of course, it's handled by the department, this part of the investigation. I asked it to take place, and he will report back to me on what took place. It's an ongoing, I believe, an ongoing situation that's been dealt with, just to make sure that the staff is trained and updated to make sure how they handle these issues. For an example, if a veteran can ask whatever they wish to a worker, but a frontline worker cannot discuss this issue with a veteran.
Understood. Now,
and if this does happen, they're
sure.
instructed to go to their supervisor right away with that issue and indicate to the veteran that's exactly what they did, just to make sure that this is handled and to do everything possible to make sure the likes of this horrible situation does not happen again.
So I think you just indicated that the investigation is ongoing, is what I think I heard there. Now, it's been just a little over 2 months since this has been reported publicly, and longer than that since the incident occurred. When we're talking about a situation where a veteran comes crying for help to Veterans Affairs and is instead suggested that maybe you should consider killing yourself, that's, to me, sounds like it should be a high priority to deal with. And I would suggest that that's far too long for an investigation into that. Like, this should be #1 priority to make sure this doesn't happen again. And when the investigation is still ongoing, that tells me it maybe wasn't taken as seriously as it should have been. So can you tell me, when will the investigation be done, and what kind of consequences would be faced if on the part of an employee if this was to occur again in the future? What would be the consequences?
Well, of course, the consequences, or what consequences will be taken now or in the future, is up to the department. They administer the staff at the department. That is what they do. We put the rules in place. The department implements the rules, and that's what they're doing right now. Again, I would have to let the deputy, in all fairness, explain to you when you wish to speak to him, in order to take a minute and just give you some.
I would be happy to let him do so now. It sounds like that might not be possible. If I guess I'll have to see if I can get another opportunity
round,
when it's his hour.
Indeed, I can tell you, Mr. Richards, when I heard it immediately, what I did was instruct him to do this.
Well, and I appreciate that,
and to make sure
I'll
that
ask him about
every
it
measure is taken. I'm sorry,
Excuse
Mr.
me,
Chair.
Minister, I'm sorry, time is up. And just to remind members that the Minister is there for an hour, and we're going to have the 2 other witnesses with us. So right now, I'd like to go to MP Charles Rogers for 6 minutes, please.
Well, thank you, Mr. Chair, and welcome to new members of the committee, by the way, and I'm looking forward to working with you on behalf of all of our veterans. Thank you, Minister, for being here, and Mr. Ledwell for being here as well. I, too, was shocked, Mr. Minister, when we heard about this, and quite frankly, it's a very sensitive issue that I was somewhat aghast about, and I'm wondering what kind of questions I should even ask you today, quite frankly, that something like this could possibly happen. So anyway, I heard your initial comments, so I'll go through some of these. But so can we continue to improve VAC staff training in light of this? And I'll also ask you what safeguards can be put in place or have been put in place to ensure that an incident like this never happens again, particularly when we hire new staff going forward in the future.
Thank you very much. Mr. Rogers, what was done, of course, I indicate what was done. What I did immediately when I heard it, I went to the deputy and said, I want this investigated and dealt with. How that's dealt with is up to the department. But what we have to do and make sure that we continue to do is do the appropriate training for veterans. You never expect the likes of this to ever happen. It's inappropriate, no matter what way you look at it, totally wrong. But you got human beings dealing with human beings. And what we have to do is make sure, and I would have to say for the Veterans Affairs staff, I've been around politics a long time, and in fact I've been in Veterans Affairs previously, I would have to say they're probably the most dedicated public servants I've ever met. But this was a mistake, and it was wrong, and it was unacceptable, and whatever words you could use, it's totally wrong in every way. But what you do when this comes up is that you put a training program in place. It will probably include more than that, but that's not the field that I'm in. I'm to make sure that this is properly investigated, dealt with, and the training programs are in place. And the deputy will indicate to you later, or right now if you wish, in fact, what is taking place, and perhaps you'd like to hear that.
Yeah, sure. Deputy, if you'd, Mr. Lidwell, if you want to comment, sure.
Thanks for the question. Just to be clear that our first order of business when this transpired is to focus on the veteran with whom this transpired with, and to make sure that that veteran is addressed, and that took place immediately and regularly upon learning of this. But in terms of the training, we put out a notice to all of our staff to make very clear that our employees are not to engage on medical assistance in dying. We can provide support for questions that are brought forward for anyone that might have questions with respect to benefits and anything that might affect the benefits for they or their family members. So we provided that clarification. We undertook training sessions with the entirety of our frontline staff, any staff member who is engaging with veterans. That training has occurred now with 75% of those frontline staff. We will get to 100%. That training also will be underlined and made mandatory for every member of staff and every new member of staff to invoke the fact that we are a department, we are employees who are not to engage with veterans on medical assistance in dying, only to be there to respond to any questions that they might have with respect to the benefits and the effect on that.
Thank you, Mr. Lidwell and Minister. I was, I guess, somewhat relieved to hear that this was an isolated incident, that there was not a number of these cases. That in itself was a bit of a relief. But so going forward, Mr. Minister, in terms of, we know it's important to hire and retain staff people directly and who deal with veterans, and the more experience they have, the better they are at their jobs. So have we made any recent investments in our frontline staff to try to make sure we get the right people in place and the right number of people?
Well, of course, that's a very good question and totally appropriate. And of course, yes, we place the highest priority in making sure that veterans and their family receive the support they should. And with that, exactly what you said, to have the people in place in order to do with it. We have increased funding for case management service in response to meeting demands, and we got about 14,000 veterans dealing with case managers. In fact, we just have invested $43 million to extend 89 frontline staff, including 50 case managers and 25 veteran service agents for an additional 3 years, which will help reduce the ratio and allow veteran managers to spend more time with their veterans. So that is, you continually attempt and work hard to make sure that you have the appropriate people in place to deal with the veterans, and it's fair to say that we do that.
Mr. Chair, we're done? Thank you, Chair. Thank you, Minister.
Now I would like to invite Mr. Luc Desilets. You have the floor for 6 minutes. Thank you, Mr. Chair. Thank you, Mr. McCauley. Thank you, Mr. Ledwell and Mr. Harris, for being with us. I believe that this was an isolated incident, and it could have taken place in a different format in a different department too. So I just want to dig in on one aspect of this. Do we have the verbatim of the interaction, the exact words used by the veteran or the employee? Because we are going to have 2 or 3 sessions of our committee based on what was published in a newspaper. Do we know the exact words that were used? This might be a question for Mr. Ledwell or Mr. Harris for the most part.
You're absolutely right. I do not have that information, nor should I have that information, but I would leave it to Mr. Harris, if you could expand on that.
Merci pour la question et je peux dire qu'on.
Thank you for the question. What I can say is that we don't have a complete transcript of the conversation that took place, because we do not record all of the calls coming into the department. Only calls made to the call center are recorded. This was not a call to the call center, but I can confirm that the employee who engaged in this conversation confirmed that they brought up medical assistance in dying with the veteran. This is an event that took place with one of our employees. While you do understand the importance or the weight of the words used on both ends, because you can use the expression medical assistance in dying in any context, in any sense. I'm not trying to protect the employee at all, by the way, but when it comes to this employee, do we have more detailed information? Is this someone who has experience? Is this someone who has a permanent position with the department, or are they on a contract? I just found out that it is a female employee, by the way, from what you said. Again, I can't go into details regarding the employee. The employee is protected by the privacy legislation, so I can't go into detail of the exact situation of the employee. But I can confirm, well, it has been confirmed, that this was a discussion that was taking place, the discussion on medical assistance in dying. I cannot confirm whether the veteran or the employee said any specific thing, because we don't have records of that. Okay. Well, this request for additional information, or this follow-up that we're working on, but leaving that aside, what I will ask is that will the report be made public? Mr. Macaulay, let's hear this from you. It's been a while.
A report been made public with me. I will certainly deal with the committee on that issue, yes.
We will see what the committee has to say on that. That's it for me, Mr. Chair. Thank you very much, Mr. Desile.
Ms. Rachel Blaney for 6 minutes, please.
Well, thank you, Chair, as always, and thank you to all the members that are here with us today. I appreciate you taking the time, because this is a very serious incident, and I think all of us appreciate deeply the service that the people who served us in uniform provided for us, and we want to make sure that when they need assistance, that they get the assistance that they require. And we don't want in any way for that assistance to go sideways. And unfortunately, this is a clear example of it going somewhere that none of us, I think, are comfortable with it being. So my first questions are, of course, for the Minister. If you could talk to us, Minister, through the Chair, how did you find out about this situation? Was it through the media report, or was there a complaint that was provided from the veteran directly to the Minister?
Thank you very much, Rachel, and I certainly fully endorse everything you said previous to the question. I was informed through my department. That's how I found out through and by my staff, not by the department. And I expect the department to inform the staff.
Thank you so much. And I'm just wondering, have you had the opportunity to reach out to that veteran and personally apologize for this?
No.
No. Okay. Thank you for that.
And I have indicated quite clearly how inappropriate it was, how sorry I am, apologize, and everything you can do legally in order to deal with this most unfortunate incident, to say the least.
So I will send this one out and allow all of you to decide who should be the best person to answer this. But I guess what I'm really curious about is, do we have any sense of how long this member worked and what role that they worked in the department?
Well, of course, with the employees, the privacy issues and all that come in, and I think I would let Paul, or Deputy, you better handle that because
Well, as Mr. Harris indicated before, we can't get into the details of the individual employee, but we can tell you that it is an employee who was well established as a veteran service agent. I can also indicate to you, to earlier questions as well, that since this came to light, that this employee has not been interacting with veterans while we ascertain the issues contained on this particular circumstance.
So it leads to another question for me around training. And I would imagine that in the training that is provided to people who work directly with veterans, that I would hope that there was some sort of assistance on how to address issues of MAID if the veteran brings them forward. Because again, this is a very important conversation that should of course only happen between a person and their health provider. But we also know that veterans are calling often in distress. And so I would imagine that there was a fulsome training process for all of those folks so that when veterans come to them in distress, that there's some capacity to address those issues and give them supports and reference to where they need to go next. So I'm just wondering, is there anything you can share with us or could provide at a later date around training for folks that work in the department around specifically addressing the issue of MAID if it is brought forward? And I think the other part of that training is there anything that ever says that a staff member should ever bring forward that idea?
Rachel, thank you very much. Absolutely correct. There's no way, any way, that an employee should ever bring that up. But as you've asked, if any veteran can ask any question they wish, but if any question is asked to the department official on their frontline worker, they are instructed through training to make sure that they bring this immediately to their supervisor and that the veteran is made aware that it's brought to the supervisor. Because we want to be open and clear, but we certainly, Veterans Affairs staff, they have no authority to discuss MAID or assisted dying with. Now, of course, the veteran can ask about pension and about programs that are, and how programs are involved, but the training has indicated quite clearly that if any veteran brings up the issue of MAID, they're told that they go to they're going to inform the supervisor, and the supervisor will deal with that. It's an issue that we are not, Veterans Affairs frontline workers are not to deal with.
So then the supervisor must be given some training on how to address that issue when they are interacting on the other side of responding to a veteran. So could I get some clarity on what that would look like? Well,
I would let the deputy continue on that, but of course, as you know, with MAID, well, you're asking the question too, that it's their health authorities and the individual themselves. That's where that discussion is to take place. Veterans Affairs is for assistance and help in making sure that the veteran has a better life. It is not a department that deals with MAID. But Paul, or Deputy, go ahead.
The policy and the guidelines are very clear that our employees are not to engage directly on MAID. The only time, as indicated earlier, that they are to respond to MAID is if there's a technical question about the benefits and the impact on that. that the relationship between the veteran the relationship is between the veteran and their professional health care provider when it comes to the issue of MAID. All of our staff, our frontline staff who are interacting with veterans, are equipped with trauma-informed training, with training around suicide prevention and suicide awareness, and many other aspects because of the circumstances that veterans are coming forward on. So every single member is equipped. When it comes to sensitive issues, those get augmented to more senior people within the organization.
Well, thank you, Ms. Blenny. And now let's go to a second round of questions, and the last one with the Minister. And I start with Mr. Fraser-Tolmie for 5 minutes, please.
Thank you, Mr. Chair, and thank you, Minister, for joining us today. Mr. Minister, you had stated earlier on that you've been around in politics for a very long time, and I think you would probably agree with me that politics is a performance-based industry. Recently, we've sat in these committees where we've been given reports from the Ombudsman, General Auditor, PBO, our own committee reports where wait times for service delivery has not decreased. It's continued to go on. And now we're sitting here dealing with how the service is being delivered. Your statement mentions training for frontline staff. And, you know, I have a question of what kind of training can there be under the law MAID is a discussion to be had between a physician and a patient. And your department has no mandate to be part of that discussion. This law was passed back in 2016, which the department should have been made aware of and should have had policies in place. So my question to you is, if this is an isolated incident, why is the investigation still continuing?
Thank you very much. And the investigation and the training both is continuing to make sure that the frontline staff are aware of what they, because of this issue, as you're fully aware, because of this happening, we have to make sure that the frontline staff are fully abreast of what they can and cannot do. And as far as the training goes, I'm not much on the training side. I'll have to let the deputy, if you wish, you want to let him speak to that, he can for a minute or so.
No, that's okay, Mr. Minister, because the question that I asked was about the investigation, not about the training.
Well, thank you very much. I don't do the investigation.
Well, I'll continue down this line of questioning because the question I have is how do we know that it's only one employee and that it's just one case?
I appreciate your question and your concern. The only thing you can do as a minister is you go to your deputy and indicate that there's a difficulty and this has to be dealt with and it has to be investigated. That's exactly what I did. And that is what, from my understanding, is that's what the deputy is doing and that's what the department is doing, to make sure that the frontline workers, just what happened in this situation, what happens with the employee or whatever down the road, and the training part to make sure that they're fully abreast of what they can and cannot do. And if they deal with these issues, as we said here before, we are repeating, and I apologize, but the fact is, if a veteran brings up the issue, which a veteran can, then you have to know how to deal with it.
Okay, thank you, Mr. Minister. Mr. Minister, veterans come from a background where there's a code that they live by. And one of the continuing themes that we see in this committee is that vets do not feel valued for their service. And so the question I have is, how does someone who has PTSD is facing this challenge, and then someone comes to them and says, we've got a way to end your life, how do they feel valued? And then on top of that, when they bring that forward, how do they feel valued if you've not gone to them and apologized to them?
I only got a very short time, but the fact is, I think veterans are more respected than they have been I've been around, as I said, for a long time, and what impresses me is the commemoration events. I don't want to do this to kill time, but the fact is, veterans are more respected, and they are more thanked in this country. And it's been years ago, I was in Veterans Affairs, and you went to Europe and you saw big crowds. Now you see big crowds in Canada, and I think it's only fair to say that. But Canadian people truly appreciate what the veterans have done. But what you're talking about, I agree with you. Quite simply, it should not happen.
Will
It
you
is wrong.
apologize to that gentleman?
Pardon?
Will you apologize to that person that brought forward that complaint
I don't
on
know
behalf
who-
of the government of Canada?
I apologize any time for anything like
Well,
that.
I think he
for sure.
deserves that apology. Will you apologize to him?
I apologize right now to the individual that this happened to.
I
And
think-
no problem. And I think it's right to do, because that person worked hard to make sure that I can do this and you can do what you're doing with me. And I respect that. But Canadians respect that too, and we have to protect that.
Well, I think a personal apology would work because, again, we've been talking about feeling valued and devalued. Doing it in this committee, I don't think that values that,
Well,
that person.
I appreciate you saying that, and I understand you saying that, but because of the privacy and the situation as it is, I can't at the moment. But I would just love to shake hands and say I'm sorry that this happened, whoever the individual is that had this happen, because it's totally inappropriate, and we know that, and you know that, and Canadians know that.
So thank you,
And the chair
Mr.
is-
Tolmie. And now I'd like to invite, I have no choice, Minister, I have to invite Mr. Wilson Tolmie. He's on Zoom to ask questions for 5 minutes, please. Go ahead.
Thank you, Mr. Chair, and thank you, Minister, and your team joining us today. It's unacceptable. That's one thing that comes to my mind. Veterans need help, and thank you, Minister, and the department for all the work you have done for our veterans across Canada. Is there more? Maybe I can ask this following question: Is there more finding of the investigation that the department had undertaken share with the committee?
I appreciate the question, but in all fairness, the man that's in charge of the investigation is to my left, and I think it'd be more than appropriate for him to explain to you just what takes place. I do not handle investigations. He does.
Great, thank you.
So if I could, Mr. Chair, just to indicate that the thoroughness of this investigation was in relation to the seriousness of the incident that occurred. So first we reviewed all of the files that were handled by this veteran service agent to see if there was any reference at all to anything similar or like this in their dealings, interactions with veterans. Secondly, we reviewed all the files through the department and the interactions with veterans to ascertain whether any situation like this may have occurred that was not brought to our attention. In both those cases, we identified that there were no other cases. There was one other incident with this veteran service agent where they responded to an issue as it was brought forward, unmade by a veteran, but in no other instance have we found that the issue was raised proactively by a Veterans Affairs Canada employee with a veteran. We also ensured that the veteran themselves was reviewed, that their file was reviewed to ensure that we were providing all the supports that are necessary to that veteran through their history in dealing with Veterans Affairs Canada. So all of that was undertaken with the thoroughness that we possibly, as much thoroughness as we possibly could, to ensure that this was an issue that was identified and, as we confirmed, was isolated in the department. That does not negate or diminish the seriousness of the issue. And I think that the undertaking of the investigation and the response to it is in relation to the seriousness of the particular incident.
Well, thank you for your response, Mr. Letwell.
And I'd just like to say that what the committee is doing right here puts more light on how horrible this is and how unacceptable it is nationwide. And I appreciate it.
Thank you. Thank you, Mr. And maybe, Mr. Letwell, can you share a little bit more on what is FAC actually doing to help veterans struggling with mental health conditions? That maybe you can speak a little bit more on that.
Thank you very much. As you're fully aware, we announced a $140 million mental health program, and of course that's so vitally important. And the difference with this mental health program is that the veterans can start receiving benefits immediately upon applying for they have 2 years in order to work on the issue and, let's say, go to a doctor or whatever psychiatrist. They have 2 years to do this, and of course, if it's approved, they continue on. But the benefits start immediately with the $140 million. Because mental health is such a big issue countrywide, that is a good question, and it's important that veterans know that, because if you deal with the issue earlier, it's much better for the veteran, and that's what we're trying to do, to make sure that we get the assistance to the veteran as quickly as possible. And the mental health, the $140 million, and the immediate, you're able to start receive it, and it's so important. I thank you for the question.
Thank you. And Mr. Chair, do I have the red card or?
Not yet, not yet. We have 30 seconds left.
Okay, well, I have all my questions asked.
Okay, thank you so much, Mr. Miao. And là, et maintenant, nous allons.
Now we will have 2 short question periods, 2 minutes and a half. We will start with Mr. Luc Desile. You have the floor. Thank you, Mr. Chair. Mr. Chair, I'm not an expert in procedure, but would it be all right to officially ask that the committee asks officially to the department to provide us with a copy of the report once it's done? I am looking at our clerk. I think, yes, members of the committee have the right to ask this from the department. Okay, so when the demand is officially done, we will have a copy of the report. Am I getting this right?
The committee will have a copy of the report.
Perfect.
Officially, you get.
Excusez-moi.
Excuse me, the clerk is telling us that that has to be done via a motion, which will need to be adopted by the committee. Okay, so will we do it shortly? I'm just using my time fully. Yes, we can do it during the session or at any point in time, and then we will vote on that. Okay, we might do this after I've asked my questions. So, Mr. Harris, can you please let me know how long it takes to undertake this investigation, this type of an investigation? It depends. There is a lot of data to be reviewed, many people that need to be interviewed. They're not always available either. They might be on leave. They might be on sick leave or away for any other reason. But there is a lot that goes into this kind of an investigation. So it depends. But what can we expect? What can we hope for? Are we talking about 3 months, 6 months? It depends on the availability of the people concerned. So it might take a couple of months, up to several months. So you are right. It can take anywhere from 3 to 6 months. It all depends on the availability of the people who are involved in the investigation. Okay, perfect. Thank you. Mr. Minister, I cannot judge this type of an incident. I don't have the facts, and this could have taken place anywhere else, this sad incident. But do you not think that, because we don't have information on the employee, do you not think that had we had more permanent staff at the department, this could potentially be something to help limit the repercussions, if you will, because half of your staff is on a permanent basis and half is on a contract basis, and it is not good. What do you think about this?
I understand this. I will turn this over to my deputy. He's the one that handles the investigation, and I think the employee has been around for a while.
Je dois clarifier que dans cette domaine.
So I should clarify that in this field we have a lot more permanent staff. It is different than the other case that we discussed, the one about benefits for veterans. On this one, Stephen can give you a bit more detail, but the large majority of staff working in this field are permanent staff members. Okay, thank you. That'll be all for me. Thank you. Thank you, Mr. Desilets.
Invite Ms. Rachel Blenay for 2 minutes and a half, please.
Well, thank you, Chair. So thank you for so far the information. I think it's helped me clarify some things in my mind. But I'm wondering, we talked earlier, my questions were about the training process. So I guess my next question is, due to this incident, will there be any modifications to the process of training that you're doing? Is there something that you're adding to hopefully address this? And I want to know if that training is going to apply to new hires, but also to people who've obviously been around for a while.
Well, I can assure you the frontline staff that's hired or dealing with veterans calls, they will certainly be trained in this process. But again, the man that's doing the training is to my left, so I should let him do it, but we had to make sure that that happened, for sure.
And we
And
should,
the managers.
we should be clear that this reference, this policy, and these guidelines have been in place. And there has been training reference to this for some time, but this incident has augmented the focus of this aspect in the training. So it will be mandatory. It is mandatory. It will be mandatory for all new and existing employees to undertake this training and to be refreshed on the training on a regular basis as well.
Oh, thank you. Well, that's very helpful. Now, maybe I'm going to be going to Mr. Harris on this, and it's very good to see you. Haven't seen you in a while, Mr. Harris, and as you know, I always enjoy my time with you. But it just sounded like, and I know that there's privacy rules, so I'm trying to be respectful of that. But it sounded to me like when you were talking that it was like the worker called the veteran. I'm just wondering if you could give us anything more concrete about how this interaction happened, and if it was in something that was engaged in from the veteran or something that was engaged in from the worker.
Thanks very much for the question. It's nice to see you as well. Without going into too many details and sort of incorporating a private conversation between the VAC employee and the veteran, there was a discussion around current status of how folks were doing. And it was brought up inappropriately, as the minister and as the deputy have indicated. It was brought up inappropriately, a consideration for medical assistance in dying when somebody was expressing some difficulty that they were having. And so I would acknowledge that the employee brought it up inappropriately, and then the discussion sort of went from there into a much more difficult circumstance, as I understand it. Again, I don't have a recording of the phone call. We won't have a recording of the phone call that took place. It was, in fact, as I understand it, the veteran who called into the veteran service agent, and they had a discussion around status, benefits, things of that nature. And that was one of the elements of the conversation that came up.
Thank you so much, Mr. Harris. And now for 5 minutes, I'd like to invite our new colleague on the committee, Mr. Terry Dowdale, for 5 minutes, please.
Thank you, Mr. Chair, and I want to thank everyone, and I'm excited to be here and part of this committee. I come from Simcoe Grey, and I have baseboard, and that's in my riding, and a lot of the individuals that are there, when they do happen to leave the forces, they do stay in the area for a couple reasons. The taxes are low, and they have a great member of parliament. And I guess what I would sort of like to begin with is I heard you say a little earlier, Minister, and thank you for being here, that you went to the Deputy Minister. Who found out about this first? I would think that probably the Deputy Minister would find out and let the Minister know.
Thank you very much. I was informed by my office staff, but, well, of course, I believe that I'll leave it to the Deputy, but you found out and you informed my staff, and I instructed that we would have the investigation right away, because there's no trouble to tell, as you fully know. This was terrible.
My concern is that if somebody didn't do it through the media, how would we have known? If you should know that information immediately, I would think, or you shouldn't find out through some other source and then go. I don't think to the minister.
I appreciate your question, but I don't have any access to any like first-line worker calls in the department. I do not have access to that at all, or anything that happens there.
Okay, and then through the media, the veteran in question said that your department, and I'm going to quote this, the servant agent told him in the call about having helped another veteran access resources for medical assistance in dying through Veterans Affairs Canada, including support for that person's children who were struggling with the impeding death. Have you or your officials been able to confirm if this is the case?
No, I cannot confirm that at all, but I'll leave it with my deputy, but you can, you know.
Thanks very much for the question, and we can confirm that that's the case, that there was another veteran who raised the issue. That veteran raised the issue with that particular veteran service agent.
So they did. So are there other individuals that you know of, or the minister, I guess directly, that other individuals outside of this that perhaps have used MAID or been recommended to use MAID?
In no other case that we've been able to ascertain has an employee of Veterans Affairs Canada encouraged and engaged in the conversation about MAID without the issue being raised first by the veteran.
Okay, and I would just follow up as well at a municipal background, and if there was a health and safety issue through the ministry, not only that individual would be looked at, I think that there's a bigger problem, and I was kind of worried when you said that this was an employee that was well established. To me, that brings more sirens to the fact that perhaps there's other issues that need to be looked at, and I just want to state for a fact, I come from the Department of National Defense before this, and we have a hard time getting new people because there's so many issues that red flags popping up. And I can tell you, these veterans that are leaving with their wait times and with these kind of issues, those are the ones that would suggest to people this is a great career to go in and be there for us as Canadians. So what's your comment to that?
Wait times?
Just in general, we need more people to enter.
Oh, absolutely.
And
I mean,
who would go there with the issues that we're seeing here? Like, who is going to speak positively about it? I just got on this committee 2 days ago, and I'm getting calls from veterans struggling. I just got my name on the sheet. So there's some major issues, is what I'm saying, with this department. And if any more people through MAID died on this, there's got to be a big investigation.
I want to be sure that I'm following you. Are you talking about MAID or generally people that are in trouble and difficulty?
People
and
in the
need help?
military that got recommendations to go and use MAID.
I can't respond to that. I would have to let the deputy do it. I would not have that information.
And as I've indicated, and I'll say again, our investigation and a thorough review of this suggests that this was a single isolated situation where the issue was raised unprompted by the employee with the veteran. Any other case has been, and a case where a veteran has been getting clarification on the impacts on their benefits if they were to pursue this. And the relationship and the understanding around that issue is between them and their health professional.
Okay, and one of the other sad things when I was National Defense, and I think it's great that you have this joint suicide prevention strategy between the two ministries. I think that's fantastic, but there were still 12 deaths, which is sad. The number's not going down. Do you keep stats for Veterans Affairs? Are there follow-ups for those individuals? Do you keep those statistics? You did a study. Is there any follow-up?
As much as we can, yes, we follow those stats. We also, if there is an incident.
So do you know now how many people? Is that number going down in your ministry, or is the number went up?
I'll defer this question to my colleague, who in his area tracks these things more closely, and there will be a lag in terms of the reporting on this.
Thank you, Mr. Lidwell. We don't have time for that. And for the last questions to the Minister, it's going to come from MP Richie Valdez. For 5 minutes, please.
Thank you, Minister, for joining us, Mr. Ledwell, Mr. Harris. I appreciate you joining this discussion. I actually remember the time when I opened the news on my phone, read the article, and I was completely shocked by what could have possibly happened to our veteran. I'm putting myself in a veteran's shoes right now, and it's not feeling so good. It's heartbreaking. So I used to manage a very large, high-paced call center. So my colleagues have already brought up the fact, the questions around frontline training and all that stuff. But What I want to know is how are we training in VAC the managers and the leaders who support our frontline staff? What type of training do they have?
Much for the question, and I believe the deputy would have to handle it. But of course, in every section or area in Veterans Affairs, there's different type of training. But of course, this issue has created a situation that had to be dealt with immediately, and we had to find out if it was a core problem, and that's what we did, and to make sure that it was addressed. But without a question, all people that work with Veterans Affairs are fully trained, and I said before that without any question, the most caring with their heart is in their work, for sure. Not saying other public servants don't, but when you deal with Veterans Affairs, they're dealing with human issues, and without a question, they truly care. But our deputy, you can.
Well, we do provide regular and advanced training for our managers and our senior people who themselves are supervising and providing oversight for other officials. As I mentioned earlier, there's a lot of training around suicide prevention, suicide awareness, trauma-informed training as well that is provided to every frontline staff, and more advanced training, awareness and understanding. Many of our employees have been with us for a long time and have developed innate and great understanding of the issues that veterans are facing. Very professional, as the Minister indicated previously, in their interaction and dealings with veterans. And many of them as well come to us, even as new employees, having had some experience in dealing with those who have served in the military. And we place some privilege over those who are coming in with that kind of experience. So we do have a very professional staff who are constantly trained up and retrained, and the capacity is constantly being addressed.
Thank you. Mr. Ledwell, can you clarify how coaching happens in, the environment? So is it like a side-by-side? Are they listening to calls of their frontline staff just to ensure ongoing support for the frontline staff?
And if I could, I'll ask my colleague, Mr. Harris, Stephen, who's responsible for this whole area, to actually speak to that issue.
Sure, and thanks again for the question. I think there's lots of different kinds of training. Over the course of the last number of years, of course, during the pandemic, we've been doing more things remotely, but we also do training as we bring on new individuals into the organization, where they start with a smaller caseload as part of their work. Their work is reviewed by quality assurance officers and training officers. So we have training officers, we have folks who do quality assurance. We have regular training sessions that happen sometimes in person, although more recently virtually. We have messages and resource kits that are available for folks to be able to kind of keep up to date on changes in terms of our policy, our legislation, our benefits, or our services as well. Those are shared regularly with staff. So there's a variety of means that we use to make sure that our staff are up to date in terms of their knowledge, but also up to date in terms of, as the deputy mentioned, the more side of elements having to deal with, whether that be suicide, trauma-informed care, working with folks suffering or having issues on mental illness and others, to make sure that they can be sensitive in all of those situations. So that training is ongoing and is both intensified for those who come on for the first part or starting with the department as well.
Thank you. And the last question I have.
I would just like to indicate to Mr. Dowdell that without a question, mental health issue is frontline and a great concern. And that's why we pushed to get the $140 million to make sure it was accessible right away. Your questions are very important, and all questions are so important, but I didn't get a chance to respond to that, but vitally important, sir. And I appreciate that question, and working together, the more we can do to make it better for veterans, that's what I'm here for. But I thank you for that question, very much so.
Minister, and thank you also, Mrs. Valdez. And je voudrais revenir sur.
I would like to come back to what Mr. Desilets was saying and clarify the situation. So if the department wants to send the report to us, to our clerk, that it would be with pleasure that we will receive it and distribute it to the members of the committee. If there are personal information, as you know, we have the law clerk that can redact certain parts of the report. Other than that, it is up to the committee, indeed, to bring forward a motion on the subject. So what does the department think about this, about the report?
Mr. Chair, I can assure you if the committee asks for the report, you will receive the report.
Okay.
It's appropriate for you to ask for the report, and then we'll make sure you receive the report.
Yeah. Okay. Thank you. So, Mr. Richards.
Let's make the request then as a committee. I'll make the suggestion now that we request the report.
Yeah. Okay. So do we need a writing motions? No, it's clear, but we have to specify a date also that the minister should send the report to the
Well,
clerk.
I would just suggest is immediately upon it being available.
Yeah.
Okay. Ms. Blenay?
I agree. I think we've heard clearly from the testimony that you don't know exactly when it's going to be, so I don't want to put a date on it that you can't fulfill. So I agree, and I thank Luc for bringing this forward. I think I agree with the timeline that Mr. Richards put forward.
Merci.
Thank you.
Ministre?
Mr. Minister?
Yes, I can assure you that when the report is completed and ready to be transmitted to this committee, it will be.
D'accord. Merci.
Okay, thank you. Okay, so I would like to ask Mr. Desilets, based on what we just heard, can you present the motion? I just sent it to the clerk. I don't know if they have received it. I just did it now. I can read it to you. That Veterans Affairs Canada provide the committee with a copy of the investigation report into allegations that medical assistance in dying was offered to a veteran by an employee of the department. I have a staff member who just did the translation as well. It's also available. I did not mention a precise timeline because you said you referred to 3 to 6 months, so we're going to go with that. In terms of the interpretation, was it all right for all members of the committee? Can we go ahead and vote on this motion? Is anyone against adopting this motion? No objection? Okay. Minister, so the request has now been done officially to the Department of Veterans Affairs. So here it is. And I also take this opportunity to thank you, Minister, because we will continue our second panel with the Deputy Minister and Assistant Deputy Minister for the next hour. So once again, I'm not going to suspend. So thank you, Minister, for being with us at the Standing Committee on Veterans Affairs.
Alors, bon, on va saluer le ministre. Bon.
Okay, we will. All right, we are going to suspend for a minute while the minute.
reprenons.
We are continuing our meeting. Just some information before continuing with our panelists.
The committee to submit your witness list for the study of National Strategy for Veterans Employment After Service in order of priority to the clerk by October 2018, 2022 at least 4 p.m. And second, yes?
Carry on.
Yeah, and secondly, I'd like to remind the committee that you all already received the report on marriage after 60. We will study that report on Thursday, October 27, and it will be, ça va être à huis clos.
It will be an in-camera session, maybe for 2 sessions.
Well, Chair, I'm sorry to interrupt you, and thank you so much for giving me this time. I just wanted to check in with you, Chair, because I think that at this point we don't have a first vice chair. And so I was just hoping that I could move a motion to nominate Blake Richards for the first vice chair of this committee.
Yeah, okay, parfait, avec plaisir.
Okay, perfect. Yes, with pleasure. We are now going to proceed with the election of the vice chair. So, pursuant to Standing Order 106.2, the first vice chair must be a member of the official opposition. So, I'm now ready to receive motions for the first vice chair.
Nominate Blake Richards.
Speech.
Okay. Thank you, Ms. Blenay. Donc, il est proposé.
Okay, so it is proposed that Mr. Blake Richards be elected first vice chair of the committee. Are there any other motions? If there are no other motions, would the committee like to adopt this motion? Okay, we have a consensus. Okay, I declare the motion adopted. And Mr. Blake Richard is duly elected first vice president of the committee. I'd like to congratulate you.
Alors,
Okay, on that note, we will continue with our witnesses. Thank you for your patience. So for the next 5 minutes, the floor will be Mr. Michael Coopers for 5 minutes.
Thank you very much, Mr. Chair. Mr. Deputy Minister, the Minister described the conduct of the Veterans Affairs Service agent in pressuring a veteran to have MAID as completely unacceptable, horrible, and he used other words to condemn those actions, and rightfully so. But I would submit not only are they completely inappropriate and horrible, they may also be criminal, because under Section 241 of the Criminal Code, it is an indictable offense, punishable up to 14 years, for someone to counsel or aid in suicide, whether or not a suicide occurs. There is an exemption. It's a very specific, narrow exemption that provides that a medical practitioner or a nurse practitioner is exempt from the general offense, provided that it is they offer such advice in the context of MAID in accordance with the MAID provisions of the Criminal Code. So, with that in mind, has this matter been referred to law enforcement?
If I could, Mr. Chair, I appreciate the question very much and the particular aspect that you're raising. And as part of our review and our investigation of this, we're looking at all aspects, including the seriousness of the issues as you were raising them. In this case, this was a conversation and not advice to pursue this. but very much understanding the issues that you're raising and the context of the code by which you are underlining. This is part of the consideration, and we're looking at all aspects of this as part of the review and the investigation.
So thank you for that, Mr. Deputy Minister, and the investigation is ongoing. So if there is evidence that arises in the course of the investigation to establish the possibility of criminal wrongdoing, I presume that will be immediately referred to law enforcement, so that a criminal investigation can be opened and potentially the individual could be criminally prosecuted if there is evidence of criminal wrongdoing, recognizing there is an ongoing investigation.
And I think that the point is if there is evidence, and if there's evidence that is well established in this regard. So our undertaking and our review of this is very much in terms of the operations under which we function as a department, and the guidelines and the policy by which we function, as well as the labor considerations in relation to this incident. And that's been the primary focus of this undertaking.
Well, I think there ought to be some real focus on exactly what this employee engaged in and their specific conduct, and including whether or not they crossed the line and broke the law and committed an offense that, again, is an indictable offense punishable by up to 14 years behind bars, a very serious criminal offense, potentially, that could have taken place. So I hope that is not brushed aside. I hope that is vigorously pursued. I think that the veteran who was impacted and victimized by this employee deserves that, and all veterans deserve that, if, in fact, the minister is sincere, and I believe he is, that he does not want to see this ever happen again, and it should never happen again. Now, with respect to this particular employee, I concur with Mr. Dowdell. Alarm bells are ringing that this was a long-serving employee who, frankly, should have known better, or one would hope. But you spoke, or minister spoke, both of you spoke, about the protocol that is in place, and the protocol that was explained is that as soon as MAID is brought up, an agent is to then go to their supervisor and cease engaging on the topic of MAID. Based upon what I understand you said, that didn't happen in the case of that other individual. Am I correct in that? I mean, there was this veteran, but there was also another veteran. They broke the protocol?
So the issue is, in this case, is the situation whereby the individual employee raised the issue of MAID with the veteran, which we have identified and acknowledged is highly inappropriate. So that's been well established.
But in the other incident where a parent, okay.
Time is up, and sorry. And now I'd like to go to MP Sean Casey for 5 minutes, please.
Thank you very much, Mr. Chair. It has been suggested, and I think stated as fact in the preamble to some of the questions, that the employee in question suggested several times to the veteran, insisted upon the availability of medical assistance in dying, and pressured the veteran into medical assistance in dying. Are any of these things true?
We've not been able to verify or establish those as the situation in this case. What we have been able to establish and verify, the employee has acknowledged, and certainly the veteran has identified, that this issue was raised with them unprompted, which is highly inappropriate. We've not been able to see any case where the employee in question persisted in this and continued to enforce, and certainly we would seek, if there's any information to that regard, that we would seek that to come forward so that we can include that in the consideration and the review of the investigation of this situation.
The minister was pressed fairly hard to directly apologize to the employee. Does the minister know the identity and the whereabouts to the veteran? The minister was pressed very hard to apologize directly to the veteran. Does the minister know the identity and the whereabouts of the veteran?
No, the minister does not.
Why not?
The minister is not in a position, and frankly, other senior people in the department aren't in a position to engage directly on files and interactions between the veterans and those who are established in our department to professionally engage and support those veterans. So the minister doesn't know the name or the identity nor the location of the veteran. I don't know the name or the identity of the veteran either.
Is a veteran service agent the same as a case manager?
No, they're not. Case managers work with 14,000 or 14,500 veterans who've got complex issues, who are identified as requiring intensive case management. Veteran services agents work with veterans who've got less complex issues and needs, and that was the case in this situation.
Which union represents veteran service agents?
I'll refer that to my colleague, Mr. Harris, but I think it's our Union of Veterans Affairs Employees, UVAE.
That's correct.
And in this case?
Not
in this case, it is a Union of Veterans Affairs employee for veteran service agents.
What?
The union has not taken a public position on this case.
We've often heard, we've often heard that it's difficult, if not impossible, within the federal public service to terminate an employee. It's something that happens without a great deal of difficulty in the private sector. I can tell you, I've done it myself. Is that true? That it's almost impossible to terminate an employee in the public service? And if the answer is no, then just how hard is it?
That's a very good question, and I've not had experience having to undertake a termination, quite honestly. I know that there are union agreements or collective agreements that guide all of our relationships with our unionized employees. We follow those very closely, and those contain guidelines and rules by which employees are to function and by which employers are to function. And so we undertake all of our labor relations in those contexts.
And Deputy, if I may add, it is not impossible to fire or release an employee in the federal public service, as you've noted. There are rules that govern that, labor relations processes, collective agreements, and policies that come from our Chief Human Resources Officer.
Thank you. Those are my questions.
Well, Mr. Kelsey, thank you. And now, pour deux courtes interventions.
For two short rounds, I'd like to first invite Mr. Luc Desilets for 2.5 minutes. Thank you. So, Mr. Ledwell, this employee, are they suspended during the investigation? I can't really speak to the specifics on the employee due to the rules we have, but they do not have contact with veterans at the moment. I can say that. Okay, I find that surprising because this is an investigation that we take seriously, so we should know this information should be in the public domain. The labor union, I believe, is protecting this employee. So what steps have the labor union taken to protect the employee? I have not had any contacts with labor union representation. Maybe Mr. Harris has information on that. But the labor union represents the employee, but the labor union represents all other employees, not just this individual. Yes, I understand. I don't know if Stephen has additional information. Has there been a formal steps taken? No, I don't have details on that at the moment. Can one of you tell me how this sort of an investigation committee established? Who are the members? The minister asked me to take the responsibility for the investigation, so I'm in charge. Mr. Harris, Assistant Deputy Minister, is responsible also for the department that is overseeing the investigation. So they will be submitting the report to me, and I will submit it, I will provide to the minister. So is the committee made up of just you, the two of you? Well, we don't really have an investigation committee. Okay, not a committee, but people that are handling the investigation, taking care of the details, and there will... But who's doing the investigation in this case? People who are responsible for these branches of the department. Mr. Harris is one of them. As the Assistant Deputy Minister, we have the Director General, who is responsible for our interactions with veterans for this region. Thank you, Mr. Desile. Now, Ms. Blaney has the floor for 2 minutes. 2 minutes and a half.
And I think it's important that we acknowledge the fact that the department has removed this person from providing direct service. And I think that's something we have to respect, that there's a lot of things that we have to consider, but making sure that the veteran is cared for is obviously a priority, and I just want to honor that. I'm coming back to you, Mr. Harris, through the chair, of course. I apologize for my confusion, and I'm sure that you will clear it up. I'm just hearing things, and I just want to clarify. I think what you said is that this was not a call through the call center, and I think what I heard you say is the veteran made the call directly to the service agent. And from my understanding, there isn't a way to do that. So is there a way to speak directly with a frontline worker like a service agent without going through the call center? And the reason I ask this, of course, is when you do call in, it's very clear that all conversations are recorded and can be looked after, I think is what I've heard when I've called in before. So I'm just wondering if you could clear that up so that I better understand the process of how this connection was made.
Sure, thanks very much. The short answer to the question is calls into our National Client Contact Center are recorded. Calls between veterans and case managers, veteran service agents that take place through the normal access of someone calling in to ask questions of somebody who may be responsible for their file. In the case of a case managed veteran, in the case of a veteran who may be going through guided support and have a veteran service agent associated with them, there are direct phone calls that can come in from that point of view. It's also true that the case managers call out, or veteran service agents could call out to people who they have responsibility for helping them through whatever level of support they might need. So you're right, there's a two-way flow of calls that could happen. It could come from the department because somebody's calling out to see how their veteran is doing, but it also could come in from a veteran who has a direct contact into, be it a case manager or a veteran service agent, to follow up on some issues that or questions they might have.
And so you're saying that the veteran called in directly and had a direct line to someone? I'm just trying to make sure I got that clear.
That is my understanding of this case.
Okay, thank you so much. So to clarify, service agents then have a direct number that they can give out, is what you're saying?
Yeah, in certain instances, depending on the support that's being advised, veteran service agents provide guided support to veterans. They also undertake incoming calls from various areas when they may need to triage a call in from a veteran, a member of the general public, or others as well. And so there's a variety of support that's offered through a veteran service agent. Sometimes that's the area that they're working with directly with veterans or others.
Thank you, Mr. Harris. So now let's go to our first Vice President, Mr. Blake Richards, for 5 minutes, please.
Okay, thank you. Let me just pick up on this, where Ms. Blaney left off with this call. I'm still a little unclear, I'll be honest. So this is what I understood, and correct me if I'm wrong. If a veteran calls into the general number, the direct sort of the general number, then those calls are recorded. But if the veteran calls a direct number of a caseworker, that's not recorded. And if the caseworker makes an outgoing call, that's not recorded either. So only in the case where they've kind of called a general number that the calls are recorded and nothing else is recorded? Was that what I understood? I'm not sure, Mr. I can't see your name.
Perhaps I can take this and I'd actually like to offer a clarification. So in this case, the veteran service agent had called the veteran. So let me correct my my earlier comment to the member, where I said that the veteran called in. In this specific case, the veteran service agent had called out to the veteran. Further to your question, calls into our client center, our 1-800 contact center, are recorded. Calls that take place on a regular basis between veterans, case managers, veteran service agents, that go back and forth, that don't go through that, are not recorded.
So have there been, like, that seems odd to me, but we'll leave it there. Because I mean, it seems to me as though just about every call we make to any large organization these days is there's a recording of it. So it's odd to me that only a call to the general number would be recorded and none of the other interactions would be. But so be it. We won't get into that policy today. What communication has there been? So the veteran who had this caseworker suggested medical assistance in dying to, what communication has there been between Veterans Affairs and the veteran himself who had this suggested to him since that call with the worker, the terrible incident that occurred? What communication has there been with that veteran, and how has that been undertaken?
Again, perhaps I can speak to that a little bit. And so the veteran had the initial call with the veteran service agent, and rightly was upset and contacted Veterans Affairs again to indicate that he had just had a troubling phone call with one of our veteran service agents. And so when that call came back into the department, it was escalated back to the local area office, and somebody who's in a managerial position called the veteran back, understanding that that was the issue, that it had been raised inappropriately, and somebody who is a senior manager in the position called the veteran back to speak with that individual about the concerns that they had related to that phone call. And that conversation's continued and had continued over several weeks following the initial incident.
Okay. No, I appreciate that clarification and understanding as well. I want to go back, Mr. Ledwell. I'm still a little unclear. In the first about 45 minutes or so of the meeting, we seem to be repeatedly hearing that there had been one incident. And then it seemed all of a sudden, about an hour into the meeting, there was kind of a bit of a shift in that. And I'm a little unclear, and I need to understand which sort of version is accurate. Maybe I misunderstood. I don't know, but it seemed that there was two different versions that I was hearing. And it seemed like all of a sudden there was an introduction that there had been actually a second individual who had discussions that had undertaken with a caseworker. And if I even understood that correctly, that individual actually had gone through with medical assistance in dying. Did I misunderstand that?
I can't speak to that particular last aspect that you're raising, member, but we did, as part of this file review and investigation, ascertain that this veteran service agent had had a conversation with a veteran previously, a case where the veteran raised the issue with the veteran service agent. And it was, in fact, that conversation that was referenced in the second that led to the veteran service agent raising the issue unprompted to that veteran.
So the difference was in one case it was raised, prompted. It was prompted by the veteran, and then there was conversation around it. And in the other case, there was unprompted. Okay, and it's possible, you can't tell us, but it's possible that there may be a veteran who has passed away or taken their life as a result of that conversation. You can't confirm that, but it's possible that that's the case. That's obviously concerning.
Excuse me, Mr. Richard, so maybe that next round we'll be able to ask questions again. And now I'd like to invite, he's on Zoom, Mr. MP Daryl Sanson for 5 minutes, please. Go ahead.
Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. Chair.
The new members, of course, to this important committee, welcome to our committee. It's a committee that's very emotional, as you can see. But what I find very important is that in the past, all parties have worked together in supporting our men and women who have served and who continue to serve. And I thank you for being on this very important committee. I guess I would like to start off with my question maybe for the deputy. Paul, nice to see you, and Stephen back, of course, here with us in support and to share some of the information that we were looking for. Deputy, I just would like to get from you your like when I heard the news about that discussion about medically assisted dying with an agent, I had a lot of emotions go through me. I'm just wondering how you felt when you heard that, and maybe if you want to share some of your thoughts around that.
Thanks very much, member. And I think the first reaction was one of surprise, even shock that this kind of a conversation would take place. The relationship that we have and the people in our department have with the veterans is one that's built on trust, one that's built on service, and one that's built on ensuring that the veteran is getting what they need. In this case, clearly indicated, at least when it came to light, that it was a conversation that went beyond where the employee should have gone, and most significantly, it created a great deal of trouble and negative reaction, understandably, challenging reaction from the veteran themselves. And I think that our first instance is to make sure that the veteran is doing all right, and that we are doing whatever we can to reach out to that veteran to ensure that it is identified as an occurrence that should not have happened, and that where they are going through any trauma themselves as a result of the conversation, that we're there to support and respond to them. So my first reaction was one of surprise. My second reaction was, how are we supporting and addressing the needs of this particular veteran who's gone through this circumstance? And then my third surprise was, how do we correct this and make sure that this doesn't occur again?
Thank you, Deputy. I really appreciate the fact that you shared with the committee not only the discussion around the file of the employee and all other employees, their verification, but the fact that you brought to the table that this continuous review and discussions with the veteran to make sure that that veteran is in good health and their needs and benefits are being reviewed and discussed. I think that's important that we continue that relationship on that front. Now, I know the minister apologized publicly and the department apologized publicly, but I have to assume that the managerial person who made the call to verify what took place with the veteran, I'm sure there was an apology probably made there directly as well. Would we be able to confirm that?
I think that the individual in the circumstances that this transpired realized while it was transpiring or through the transpiring of this that this had gone to a point that was unacceptable. That doesn't excuse the action, but I think that the individual, the employee, certainly recognized that. We still have to deal with the effects or the impact of that, and that's what we're doing very seriously. Has that individual apologized directly to the veteran? I can't say that. I don't believe that that's the case because the conversation came to a close, but I can't say that for certain.
Thank you. It's important for the community to note that it's not part of VAC's services to speak and or advise on medically assisted in dying. And I know that there was, once that med was passed, that that there was some training and information sent down, and now, of course, much more. But just for the committee's understanding, if someone, a veteran, brings it up, what type of conversation would we expect to hear?
Excuse me, maybe in 10 seconds, an answer, please. If not, we have to
very
go.
quickly. Member, the veteran would be referred to their healthcare professional, to their physician or their nurse practitioner, who are the only ones who are in a place to provide that kind of guidance.
Thank you,
thank you,
Mr. Sanson. And now I'd like to go back to Mr. Blake Richards for 5 minutes, please.
Thanks. I just want to pick up where we got cut off before. So it sounds like this is kind of in the course of the investigation of what occurred here. The caseworker in question in the incident that initiated the investigation has now been determined to have, there has been 2 times where there's been conversations about medical assistance in dying. As you said, one was prompted, one was not. And in one case, we may have a veteran who has taken their life as a result. And so obviously now there's more concern than there was before. I mean, now we're talking 2 instances at least. And what I guess I need to understand now, so we've now learned that it's isolated to one caseworker, is what you believe, but it may be at least 2 instances, and we don't know how many instances. And are there other veterans who are now dead as a result? What I need to ask is that where the investigation is going? Is the investigation now going back through all of the files of this caseworker to determine whether there's been other instances besides these 2 where there has been medical assistance in dying, where there's been counseling about medical assistance in dying inappropriately, and how many veterans are now dead as a result?
Well, I can assure you, member, that is part of this review, is to do a complete and thorough review of the files of this veteran service agent to see where and ascertain where this issue may have been raised. And what we have been able to identify thus far is that there is the case that is before us, the very troubling case that it was raised unprompted between that veteran service agent and the veteran. And there's one other case, again, raised by this veteran service agent in the engagement with the veteran, where a veteran themselves raised this as a consideration. We don't know, and I can't tell you right now what transpired in that case, but this was a situation where the veteran themselves raised the issue with a view to asking, as I understand it, what kind of implication that would have on the benefits for that veteran and or their family.
Okay, so I think I understand that, but what I need to hear from you is the investigation now going back through the files, all of the files of this particular caseworker, to determine whether there's been other instances besides these 2, and whether veterans are now dead as a result?
Yes to the first question, absolutely.
Okay, and what about that second question then? Will the investigation determine whether there are veterans who are now deceased as a result?
I think that the implication of the first question and the answer to it is yes to the second question.
Okay, but I wanted to be sure. Okay, and you know, I'm glad to hear that, because this is, I mean, I came into this meeting quite concerned about this situation, as I think everyone around this table is. I without exception, and I'm sure all Canadians are quite concerned about what happened. But I will say now I'm more concerned leaving this meeting, and I'm glad to hear that there's an investigation happening. And I'm glad that all those files are being looked back at. And when I ask that, are we talking about the active files of this individual, or will the files all the way back be looked at?
My understanding is it's all the files related to this employee.
Okay, that's good. That's also good news. So I would assume that that information will then become part of the report, which you've now indicated you will share, the minister has indicated will be shared with this committee? Okay, that's good. Let me, there's a couple other things. I've got 1 minute, so I'm probably going to touch on one of the other things. It was raised earlier about a couple times about the minister apologizing directly to the veteran involved in the case that led to this. I'm well aware of privacy issues that exist, et cetera. But would it not be the case that if the minister wanted to apologize directly to this individual, could it not be asked of whoever at Veterans Affairs is now in contact with that particular veteran, just to indicate that the minister would like to personally apologize to the veteran and ask the veteran if they would be willing to accept that phone call? Could that not be done?
I think absolutely it could be done. The question could be posed to the veteran, and if they're open and willing to receive that. I think that in this case, for everyone, and most especially for the veteran, we want to ensure that all of the review and the investigation is complete before that's done.
Sure. So I would just suggest to you that because the minister is no longer here, obviously, that you make that suggestion. That he did indicate he would like to be able to have that opportunity if it was available to him. I would just ask that you make that suggestion to him, that maybe that we could see that move forward so that he could. I think it would mean a lot to the veteran to have the Minister of Veterans Affairs make that apology. I think it's the right thing to do, and I hope you'll make that suggestion.
And absolutely, and I think that by the seriousness by which the minister has identified that this issue has to be reviewed and reported on, that's contained.
Okay, c'est tout le temps que nous avons.
This is all the time we have, unfortunately. Thank you. So a reminder as well, this is the last round of questions given the time we have left. Now I'd like to invite Mr. Terence Rogers for the next 5 minutes. You have the floor.
Mr. Chair, I don't know if I need 5 minutes, but I do have one particular question I'd like to put to Mr. Lidwell. So can you, I guess, clarify for the committee what is the actual role of a VAC employee when it actually comes to veterans requesting, when they request medical assistance in dying? What's the actual role of the employee at Veterans Affairs?
So the first role of the employee is to make it very clear that that's a consideration that the veteran should be engaging with their health professionals and their medical professionals on. That's an issue that we cannot engage with them on in terms of the determination, the consideration that the veteran may be going through with respect to MAID. Where we do have a function and a responsibility is to respond to the issues that the veteran may have on the implications of anything that they may undertake on their benefits and the supports they are receiving, the supports that their family members will continue to receive, and what is the consideration around that. And we have all of the understanding and the technical expertise to be able to provide that advice to the veteran, but we cannot engage on the consideration and the active consideration around medically assisted dying. And that's very clear by our policy, very clear by our guidelines, and now considerably reinforced through this isolated incident.
So I guess then it's safe to assume that once you have a veteran requesting medical assistance in dying, that sets off alarm bells, which the department engages all the medical professionals that need to be engaged to deal with this veteran?
Well, we're in a situation, and our case managers and our veteran service agents are in situations where they're in direct and regular interaction with the veterans whom they serve. These are conversations, and I think Mr. Harris indicated that transpire regularly, and there's a lot of the veteran phoning into their case manager or their veteran service agent, and the veteran service agent and the case manager phoning out to the veteran to make sure that they're doing okay, to make sure that they have the supports that they require, to ensure that they are getting access to not just the health supports, but some of the social supports, employment considerations, connection to community, everything else. So that's a regular undertaking. There's a relationship that's built up between these individuals, and an important level of trust, of course, that needs to be established through that relationship. The communication is active. We seek to be responsive and to provide the right advice and direction that the veteran needs so that they can live a healthy life. And that's really at the heart of these relationships and our service to them.
Yeah, well, that's comforting to know at least that once they've reached that level of thinking that there's, people that react and follow up and try to support them even further.
Right. In many cases, if something troubling transpires between a veteran and their case manager or their veteran service agent, that might require the case manager or the veteran service agent to come back and reflect on that. They can then either reach out themselves or raise it as the minister and as we've indicated with a supervisor. That supervisor can reach out to that individual. In this case, when this issue came to light, it was the veteran team service manager who reached out the next day to that veteran to apologize what had transpired, to check in on the veteran to see how that veteran was doing, and to see what we could do to rectify the situation that had occurred the previous day. It was that fast. And it's really important, I think, to underline that because of the seriousness by which we identify this issue, but the seriousness by which we identify the importance of the relationship and that trust that we have with the veterans that we serve.
Okay. Thank you, Mr. Chair. No further questions.
Thank you so much, but there is 15 seconds left, so I don't think we have time.
Yes,
to...
I'll,
you take
I
it,
could
Mr.
take
Sanson? Okay,
yeah,
go ahead.
Yeah,
10 seconds.
I just want to, very important. Mental health is a very important issue, and we need to do more. And I was very happy to see the 140,000 million investment for veterans where they can have the services they need right away while they're waiting for the application to be processed. That was a very important approach in this program, and I'm really pleased with that.
Thank you, Mr. Sanson. Thank you so much for your comment. And now, I'd like to, j'aimerais inviter Monsieur Luc Désir.
I'd like to invite Mr. Luc Désir for 2.5 minutes, please. Thank you, Mr. Chair. You were saying that the file would need to be closely inspected and examined, but I have a feeling that there won't be too much information to go in that because the employee who goes out of their way to conduct themselves like this wouldn't be taking too detailed notes in the file either. But so in the interaction between the agent and the veteran, you said that there were 2 other levels to it, so 2 other people got involved in it. Is that the case? Twice there was a supervisor who had contacts with the veteran, and no recordings in these 2 other interactions with the supervisor. There are notes, but no call recording. What is the difference? In certain cases, you record calls. In other cases, no. What is the difference? How do you make the decision? I can let Mr. Harris answer the question, but just to underline, there are all kinds of different exchanges happening between veterans and their case managers. There are private matters and confidential matters being discussed. When it comes to the veteran situation, so these types of discussions are usually not recorded. But, you call your insurance company or other companies, all these sorts of calls are recorded. So what I'm thinking is, in the potentially cases like this, wouldn't it be a wise idea to think about recording because you have a client, a veteran who is in a difficult situation where mate comes up, which is again atrocious. We don't have all the details, of course, but the interventions, the interactions that followed from with the interactions with higher ups, should those have not been recorded? There is a difference between incoming calls from veterans calling the department. In these cases, we are actually talking about relations that are in place, that exist between employees and the veterans directly. So it's like this discussion you're having with a physician. So these are people who work very closely with the veterans. So these calls or discussions are not recorded. Thank you, Mr. Lettle.
Ms. Blenay, the floor is yours.
Well, thank you, Mr. Speaker. And I just want to make sure that it's clear for the record that for a person in this country to receive MAID, you have to meet certain criteria. So just don't want there to be any impression leaving this place or this room that people can call in and have a conversation with anybody and then as a result have MAID as part of the solution quickly. There's very clear criteria, and I just want to make sure that that's on the record, that there's not a misunderstanding or misinformation. So coming back to this very important discussion around assuring the best care for our veterans, which I believe everybody in this room is committed to. And I hear now from Mr. Ledwell that not all calls are recorded. So I'm just wondering if there's any discussions happening within the department around this. After having an incident like this, is it something that should be considered, that all calls are recorded, obviously with very high confidentiality as part of that, to assure that if there's any such incident in any shape, way, or form that is concerning, that there's a clear way of checking in the pathway and making sure that the practice is at a level that we are all comfortable with as Canadians when we serve the people who served us.
Perhaps I'll begin and ask Stephen if he could respond to this as well. But we're not giving this active consideration at the present time. Not to say that we will not give it active consideration in the future. As I mentioned in the earlier response, some of these are very sensitive, highly sensitive conversations. And I think that we want to be able to protect the confidentiality that exists between the veteran and their case manager especially. And these are veterans with very complex needs and issues to ensure that there is a degree of safety in that relationship, and that does not get reported out either intentionally or unintentionally by any means. So we're not giving that active consideration for that primary reason, I think. But we are also aware that there are issues that can get raised that do require more senior and perhaps even more sensitive attention. So we do have systems in place to ensure, as we've indicated before, that those get escalated and that those get addressed that way. And as a consequence of that, of course, there are notes in files that are related to veterans, but not recordings of those relationships.
Thank you so much,
those
Mr. Ledwell. Thank you. And now for 5 minutes, I'd like to invite MP Michael Cooper. Please, go ahead.
Thank you very much, Mr. Chair. Mr. Ledwell, will direct my questions to you. You have said more than once, and the minister said in his testimony more than once, that this was an isolated case. At first, it was one case. Now it is two cases. You have said that the investigation is ongoing. You further said in answer to questions posed by Mr. Richards that the files that this employee was involved in are currently being reviewed. So given what is not known, given that, including an ongoing investigation, including case files that are being reviewed, how can you say with any confidence that this is an isolated incident involving this employee?
Well, we've done a complete review of all the files, and I should identify and underline, as I think we've said earlier, that this was a case inappropriate, unacceptable, as the minister had said, where a veteran service agent, an employee, was raising the issue unprompted. So it's an isolated case from what we have been able to determine, a single case where an employee has raised the issue unprompted of their own accord with the veteran. We are also reviewing the files to ascertain how many situations a veteran may have raised this issue. And as we indicated earlier, a veteran could come forward to ask questions regarding their benefits. If they were considering this undertaking, what kind of impact might that have on the benefits that they and their family receives? And there we do have guidance and a policy by which our case managers, our veteran service agents, others who are interacting with veterans can provide indication and technical information on that element.
That, but I guess, first of all, just to clarify, all of the files involving this employee have been reviewed. That is what you were saying.
That's
there are no further files that are being reviewed or have yet to be reviewed. Correct?
We are reviewing files right across the department.
Okay.
For any references that may have been raised.
So again, that's ongoing. And so again, how can you assert it's an isolated incident?
We have undertaken that review and have been able to determine that there is a single incident.
So far.
We've undertaken the review of all the files.
Yeah. And in the case, but you've undertaken a review of all the files, but you said that it is ongoing or it is not ongoing.
The file review has been completed.
Okay. And involving this particular employee, we know of the one incident involving the veteran who did not make it was unprompted. That is established. In the case of the second incident, which occurred earlier, do you have any details about what the nature of those conversations were?
We have established that this was raised by the veteran themselves.
It was raised by the veteran, but you said that the policy, and correct me if I'm misunderstanding anything, you said that the policy is that if it's raised by a veteran, then a VA, Veterans Affairs employee, can talk about benefits issues. Can they have further discussions pursuant to the policy? They cannot.
No, they cannot.
And so was that conversation strictly confined to the issue of benefits?
It was strictly confined to the issue.
And how do you know
that? Based on the file notes.
And Deputy, perhaps I could add here, as part of the review of those files, we've actually spoken to that veteran subsequent to the review. So we've spoken to that veteran. That's the confirmed
you spoke to that
details
veteran.
of that conversation.
Sorry, I'm just a little confused because it was reported that veteran had access made. And then you said, Mr. Ludwell, that you couldn't speak to whether that veteran had access made. And now you're saying that the veteran was spoken to. So we're hearing three different things.
No, sir, I don't believe it's three different things. What you've heard was the discussion was around the veteran considering medical assistance in dying. Mr. Ludwell indicated that he couldn't confirm. I can confirm to you, though, that we've spoken with the veteran as part of the investigation. And so that's what I can confirm is that's how we know the details of the conversation, because we've spoken with the veteran.
Thank you, Mr. Harris. Thank you, Mr. Cooper. And now we have one last questions. I don't know, Mr. Rogers, if you'd like to intervene.
Mr. Chair, given the time, I suggest we adjourn.
Okay, thank you. So, I understand, but j'aimerais demander aux membres.
I will ask the members, is there any objection to adjourn this meeting? No objection. Okay, we started with 5 to 7 minutes of delay, but before leaving, please allow me to personally and on behalf of the members of the committee to thank the witnesses who participated. Mr. Paul Willowdwell from the Veterans Affairs Canada, as well as Stephen Harris, so Deputy Minister and Assistant Deputy Minister, Service Delivery Branch. Thank you, and by the same token, I would like to thank all others who accompanied us, the committee's work, be it our interpreters, the technical team, and I would also like to thank our clerk and Madame Dallaire as well. So, on that, meeting adjourned. Thank you.
you.